Welcome to my podcast. Today I'm going to talk about another important case that you can face at Lab 2 or in the medical setting or the clinical setting where you work. So after you introduce yourself, as always agreed, double check the patient name, date of birth, you'll ask the patient, how can I help you? So the patient might say that I'm having this lesion in my skin for some time. I just noticed that for the last 6 months, it's been increasing and I just want to check it out. So the whole scenario here is about how you approach the patient and how you can explain and how you can persuade the patient after you explain everything. So you will just tell the patient, how did you notice? How did it happen? Is there any particular reason? Is there any particular worrying? Do you have any question on mind? Can you relate it or link it to anything in particular? So the patient decided to say that I just noticed in my leg and it's quite big. I just want to know what's that. So you will have your own worries at start, and then you will ask if there is any medication the patient might take, if there is any past medical history that's worth attention, if there is any family history of any sort of skin problem that runs in the family. And you have to be firm about the whole situation. You could be emotionally involved, but certain situation you can't. So the patient might be adamant or might have certain belief. So in this situation, the case scenario is about a naturopathic student who believe probably in nature and won't be that concerned. So you will first think you will think of that you will ask the patient that I would like to have a quick look about it. So you will stick your dermatoscope and have a look, and the minute you put it, you see some signs which is not favorable to be benign, so you'll have your own worries, and you will discuss this with the patient and tell him that I'm a bit concerned and we need to arrange for a biopsy. However, the patient will say, no, thank you, doctor, and I don't want to do that. So the whole situation here is about a difficult consultation or a difficult patient or difficult people. And it can be a source of frustration because you can't force the patient to understand what's the whole thing about. But you are compelled to give the best information to the patient in order to decide better what can work for them. And to try to be always with an open mind. So in case they change their mind, your door is always open for them to come back. So you need to endeavor this thing, and you need to discuss the whole thing and document it. So any documentation is very important in case something goes wrong in the future. So you have to explain and try to understand why the patient doesn't want to go further ahead, and try to be not emotionally connected. Just try to be detached because it won't help. And you need to discuss in non-emotional way and step back. So you will say it's it's your body, it's your choice, but there is certain concerning points that we need to not ignore, and it could have in the future some nasty consequences. So my job is not to judge you, but just to let you know about what I'm worrying about. And I could give you some time to go and think about it, and you take it from there. And if at any time you changed your mind and you want to come back, you must welcome at any time. I'm just trying to make sure that everything is quite clear to you, and you have the big picture in order to decide and take it from there. And always red flag them, and not to miss anything that you feel that it's very important. And if the patient later on decided to come back, you need to document that. And of course, if you go to send them for a biopsy, in case the patient agreed, you need always to state that will involve a scarring and what the patient might expect. It's very important because some patient might not know that, and it could put you in some medical legal litigation. So you need all of that to be informed and signed. It's called informed consent, whereby the patient knows about everything and how the scar will look like and what's the implication and the consequences of that. So I hope by that I just brief you shortly about those kind of things and how you can tackle them safely. Thank you.